Well, first, thanks to Eric and the SI team for the opportunity to be with you this morning and to share with you this incredible journey that we're on as GE trying to scale local to global solutions to improve the outcomes of healthcare around the world. Hi, I'm Terri Bresenham. I lead our Sustainable Healthcare Solutions business. And it is something that has been an amazing opportunity for us. And I'm going to share with you a little bit how a company of our size is thinking different about healthcare. One woman, one road, one small but critical medical device clutched in her hand, a portable ultrasound machine. But in fact, this is really a story about many opportunities to make a difference, bringing together scalable, sustainable innovations, along with the inclusion of more women in the healthcare economy. Seems like there we go. The world for healthcare's purposes is a very unfair place. Lack of resources, unskilled workers, challenging environments, and usually high out-of-pocket expenses means that 5.8 billion people in the world lack access to quality care. And as a result of that, 53 million people suffer premature death, and many more suffer lower quality of life. We're about changing that. We don't think that's a fair proposition for the 5.8 billion people in this world. I've lived for the last 6 years in India, where I've been able to see this firsthand. In fact, India as a country lives in 2 centuries simultaneously. You can find the world's latest techniques, best trained doctors, and amazing technologies really in the same town. I live in Bangalore. You can find dirt floor, very low, untrained healthcare, quote unquote, workers. But as a result of this, it began us thinking about what does it really take to change the healthcare outcomes in the global emerging markets. And it's been an amazing opportunity for us to think very differently, how we work, how we operate, and how do we change the way we even innovate. As I've traversed now across most of the states of India, a lot of the countries in Africa, and as well Southeast Asia and ASEAN, you can see the many challenges that governments face when they're trying to build healthcare systems. This is a picture I took at the port of Lamu in Kenya. You can see the people are loading a mammography machine in this case to ferry it upstream. It was an exciting day. We were going to bring breast cancer screening to a rural part of Kenya that had never had it before. But in fact, this is not the best way for us to help solve the problems. In fact, this is an incomplete way to solve the problem. As I began to travel around and listen more to what the governments were facing, what I was learning is that it isn't about the technology. It's many other things that they're trying to do. They don't have the skills to deliver the healthcare. They don't have the modern operating processes for which to deliver quality care. And as I was sitting here in this case, the King of Lagos in Nigeria, they really have a strong passion. They want to change the health of their populations. They know that's an important, not only just for the right reasons in the moral imperative of that, but actually for the economy. A healthy population delivers more economic output. So I spent more than 25 years at GE. I joined as a biomedical engineer. I spent most of my career as a product development person. So I have a strong technology bias. But I know that's only one part now of the overall equation. We need to look for things that will help build scalable, sustainable solutions. The way we have to think about that is an opportunity, in fact, to look beyond the superficial issues Because this is about leapfrogging, this is about task shifting, this is about creating non-conventional ways to deliver care. In fact, I have kind of this irresistible urge to not follow the Western model of healthcare in these parts of the world. So in 2016, GE created an entire new business called the Sustainable Healthcare Solutions business, which is what I lead. It's a 5-year, $300 million commitment to invest in disruptive innovation that can be scalable and more affordable, together with other ideas that we know mean a lot to these parts of the world. Things like partnerships, things like co-creation, ways in bringing capital structures around these. And also, how do we help with the skills development that is needed to help deliver better quality of care? So let me take you through a few of these. Many countries are trying to build national healthcare systems from the ground up. And that's really hard to do by yourself. Here's an example. I was in rural Kenya. This is a project that we helped design, construct, and equip with GE's latest advanced technologies. But what's more important about this is the fact that it is inside a very novel modernization project, the first of its kind, in fact, in the world. This is one of 98 district hospitals. And because we sat down with them and from the beginning designed something that could be scalable and could be designed for sustainability, we helped them with affordable capital structure so they could do all 98 hospitals at the same time, because that was important for providing more universal access to care. We helped them with the ideas around how to design and construct for better workflow. We connected their systems digitally so that they could have better clinical as well as operational outcomes. We built a training institute in Nairobi. So for the course of the relationship, we'll have an opportunity to continue to train their personnel on the latest technologies. And then, probably as important in this part of the world, we committed to maintain the equipment for the life of the product. As a result of that, in the first 6 months, there's been more than 150,000 new patients that have been seen by these new places. And the feedback from the patients, from the clinicians, and from the government are very positive. So it's working. But it wasn't the first time, this has been the first time it's ever been tried, which would be to put it all together into one. And we actually jointly share the responsibility for not only economic viability and providing low cost, but also, more importantly, for the patient's outcomes. One of the things that also struck us is the idea that 75% of the health care is consumed by women and children. And yet women represent less than 25% of the leadership in healthcare or in the policy making for healthcare. I don't know about you, but when you think about making decisions that largely will apply to someone else, you may not always be in the best position to understand how to design a system to be relevant. So one of the other things, and this leads me to another dimension that we've decided to take on, and that is, how do we help bring more women into the leadership of global health? As I said, women consume the large amount of healthcare for both themselves and their families or their children. But when we look at the overall numbers of women and the skilled labor of women in the health economy, it's very, very limited. So we wanted to do something about this. And in the US, there's been a very big public push to bring, more support for women in the workplace, bring more women into non-traditional roles like STEM. But in these parts of the world, that's still a very far-off idea. So we've put together a number of programs, starting with the World Health Assembly, which I was just at last week in Geneva, advocating for why it matters to put women into the leadership, into the health ministries, and into the policy making for healthcare. We have now put these two ideas together. We've got a plan that we launched in India with now more than 20 schools, 12 million girls in India graduate, many of them with the marks but not the money to go to college. We've worked with the government of India on a Skilling for India for a Healthier India. And we now have a goal to have 100,000 new girls into the workforce of healthcare. And I met with them recently. This was actually a reunion of our first batch of students, and they were very, very changed. When I first met them, they were shy. They could hardly make eye contact. And on the reunion, one of them walked up to me. She proudly shook my hand and said, "Ma'am, I've been promoted. I'm now the senior tech." The difference that employment and economic empowerment makes to a young woman in these parts of the world is dramatic. And we can put these two things together, the lack of skilled resources and bringing more girls and women in for the next generation. As I'm close here on time, I just want to close with the stories of the unsung heroines of health, because plenty of healthcare is being done by people who don't get recognized around the world. And I'm going to leave you with the trailer of this. We'd encourage you to help in advocating and these inspiring stories on why it's important for the health of the world on the backs of these really amazing young women. So thank you very much, and I'll leave you with this trailer.
By educating a single girl, we are helping build national assets instead of creating national liabilities.
Because it is not normal for a mother to lose a child. It is not normal. It has never been normal. It will never be normal.
Perasaan saya itu sangat panik karena saya kasihan sekali kalau apabila ibunya meninggal, kasihan anaknya yang ditinggalkan.
The society expects us to stay at home and take care of children.
I had to face a lot of criticisms. Definitely, if I had to walk the path again, I would be doing exactly the same thing.
When you tell people not to pursue what they believe in, then you're blocking something that would have saved so many lives.